Between Tuesday, April 26th and Monday, May 2nd, our PCR test positivity ranged from 21 to 27.3%, with an average of 23% for the week. This is a slight decrease from the previous week. As the Minister mentioned, hospitalizations have increased slightly from last week, and currently there are 1,267 people with COVID in hospital, including 46 in the ICU. Sadly, between April 26th and May 2nd, 69 deaths related to COVID-19 were reported to Alberta Health, with an average of approximately 10 per day. The individuals whose deaths were reported over the past week were between the ages of 28 and 102. My thoughts are with every Albertan grieving the loss of someone they cared about, no matter the cause. We are seeing, we have seen throughout the last month or so, higher levels in Calgary with respect to virus in wastewater. We know that that's a marker of transmission in the community that doesn't rely on test-seeking behaviors. But we are, again, seeing that in most other places in the province, that decline from a previous peak. We expect that in Calgary, we would start to see that as well. We know our other leading indicator of test positivity is beginning to decline. And so ultimately, I think the important thing for Albertans to be able to do when they're wondering about risk in their own community is to look at the information that's available on the Alberta Health website, where they can see multiple indicators, including the cases that have been diagnosed in the last week in their geographic area. They can see the positivity rates in different zones, and they can see the wastewater results for different cities where that's being tracked, and use that as a measure of what the risk might be in those communities to inform the decisions that they make about their daily activities.
And the reality is our hospitals and the system overall remains under significant stress. We're seeing the equivalent of yet another winter peak in patient volumes, especially in EMS and in emergency departments. The numbers overall remain in line with past years, but occupancy at a few large sites is well over 100%. And while some periods of very high occupancy are normal, this is not a normal year after 2 years of COVID-19. The staff are under real strain, and we owe them a tremendous debt of gratitude. I hope and expect they'll start to see some relief soon as the level of virus drops.